Turn now to our new series exploring hair loss and what causes it as we age and the treatment options available. This morning, we are looking into the growing phenomenon of people experiencing hair loss after COVID. We're going to talk to Dr. Jen Ashton in just a moment about her own hair loss. But first, take a look. While a battle with COVID may include the loss of smell and taste, there is one thing you may not expect to lose: your hair. It happened to 20-year-old Malika Barlow. Just months after a COVID-19 diagnosis, her thick curly hair started coming right out of her head, leaving her brush looking like this and her hair flat and lifeless.
As the hair is falling out, I'm just crying in the shower and yelling at my hair, basically being like, stop falling out.
She began searching for answers.
I stumbled across on Facebook somebody talking about losing their hair from COVID, and I was like, oh my goodness, this matches all my symptoms.
Some doctors seeking an uptick in the phenomenon known as telogen effluvium, or shock hair loss after COVID, where fever or illness causes hair shedding. Recent studies showing that 24 to 35% of patients with COVID had associated hair loss.
The hair loss happens a few weeks to months after someone has contracted COVID-19, and essentially the hairs prematurely get shifted into a shedding phase.
It's even happened to celebs. Alyssa Milano sharing this on Instagram at the start of the pandemic.
There is no hair, one brushing. This is my hair loss from COVID-19.
COVID doesn't cause hair loss in everyone, and good news, the hair returns to normal on its own, but you may have to wait 6 months to a year. To prevent this hair loss, Dr. Caterpaul recommends eating a balanced diet, taking multivitamins, keeping stress to a minimum, and in some cases, medications can help.
It's best just to minimize stressing about the hair and know that the hair will come back.
If you're dealing with it, I'd really just say that you're not alone and that your beauty is not defined in your hair and that it will get better.
Joining us now is ABC News Chief Medical Correspondent, Dr. Jen Ashton. Dr. Jen, nice to see you.
Thank you.
Dermatologists know why this is happening.
Well, there's actually a lot in the dermatologic literature on this with respect to COVID, and they're thinking right now, the two theories are that there's both inflammation and maybe an autoimmune phenomenon that causes the virus to really literally attack the hair follicle. So you have a mixed telogen picture, and in some cases, over 10% of women can have an accelerated female pattern hair loss. So you get this constellation of different phenomenon, all resulting in thinning hair or hair loss that can be very distressing.
And I know, speaking of distressing, Annie, you've been sharing it here behind the scenes, but also very publicly about your own battle with hair loss due to a combination of factors.
Yeah, and I think the key is, I went and saw my dermatologist to find out what was behind my hair loss, thinning hair. I actually had more breakage than losing patches of hair. But to be clear, people can have more than one thing going on at a time. So it can be age, it could be COVID, it could be styling damage or coloring damage or hair extensions causing attraction alopecia. It could be diet. The key is finding out what factors are going on with you so that then you can go on an all-out attack and really try to, make it better.
Well, with that attack, what are the treatment options out there for women?
I'm literally doing everything, and I think that's generally what a lot of people do because of that sense of desperation. But the first thing is rest your hair from styling, from color processing. That is massively important. Hairstylists and dermatologists will tell you that alike. There are a few over-the-counter oral hair supplements that largely contain multivitamins and biotin that can help. Hair extensions, this ponytail is from Hidden Crown. They can be really helpful for people. For me, it was increasing protein in my diet since I went vegetarian, and then PRP scalp injections, which are experimental. I have tried them and I saw a huge result. It does take months. They are expensive. They're generally not covered by insurance, but for some types of hair loss, you can see the before and after. It takes about 4 to 6 months, but that can be really helpful as well.
All right, Dr. Jen, thank you as always. We appreciate it. And later this week, we are going to look at how diet and styling, as we just heard Dr. Jen mention, can also affect hair loss, so stay tuned for that. And you can scan the QR code for more on COVID hair loss symptoms and treatments on our website, goodmorningamerica.com.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.